Welcome to Module 4 of Health and Safety for Family Child Care Providers. This series of short modules was developed to help you learn how to better prepare and provide a safe and healthy environment for the children in your care. In this module, we'll discuss various health practices that you can adopt to keep the children in your care healthy and safe. One of the best ways to keep children healthy in your home is by minimizing the spread of sickness and disease. Children are constantly touching the people and things around them, and with their young immune systems, they are particularly vulnerable to catching colds and getting sick. One critical tool for preventing the spread of infectious disease is immunization for children and adults. Immunization, or vaccinations, is a process where a person is made immune or resistant to a disease by receiving a vaccine that stimulates the body's own ability to fight the disease. Children start receiving vaccines at birth, and pediatricians and doctors follow a strict immunization schedule during well-baby visits and regular checkups. You can ask your doctor for a copy of the immunization schedule so you'll know what vaccinations the children in your care should have received. As discussed in Presentation 3, hand washing is another great way to prevent the spread of illness. Remember, you and the children in your care should regularly wash your hands using soap, warm water, and clean paper towels. A third way to help prevent the spread of illness is by properly cleaning your home. It is important that you clean and sanitize anything children regularly touch. If a child places something in his or her mouth, that item should be cleaned before another child can play with it. Another area you need to pay close attention to is how children sleep. In the United States, 4,000 infants die every year due to sudden infant death syndrome, or SIDS. This occurs when an infant under a year old dies unexpectedly in his or her sleep. While SIDS is not completely understood, doctors and child safety experts have settled on important sleeping practices to help prevent SIDS. When an infant is ready to go to sleep, you should place the child in the crib on his or her back, with no other items in the crib, no blankets, stuffed animals, or bumper pads. The infant should always be placed flat to sleep in order to allow for proper airflow. This means infants who fall asleep sitting in a swing or in a car seat should be moved to a proper sleeping position. When children are sick, we as caregivers always want to make them feel better. However, we have to be very careful about the medication we give them. As a caregiver, you should only give a child medication that was prescribed to that child. You should follow the dosage requirement on the bottle, and you should keep track of the times it was given. If you do give a child over-the-counter or homeopathic medicine, such as a decongestant, follow the appropriate dosage amounts and get permission from the parent or guardian before you give it to the child. Shaken baby syndrome is the occurrence of a brain injury due to shaking of a child. In infants, even mild shaking, roughhousing, and tossing can result in serious, permanent brain damage or death, as infants' brains are very fragile and vulnerable. Usually, this kind of shaking happens when a parent or caregiver is feeling frustrated over a crying or distraught infant or child. Oftentimes, the caregiver can't calm the child down and doesn't know why the child cannot be consoled. This is why it is important that you know what a child may be going through each day, whether he is teething or has colic or is starting a new habit at home. This information can help you be more understanding or patient, and this is one reason why communication with the child's family is so essential. If you feel yourself getting upset or impatient with the child, go get another adult to care for the child so you can walk away and calm down. Put the baby or child down in a safe place and take a few deep breaths. One last health practice you need to be comfortable with is caring for a child who is injured. Licensed family child care providers are required to be certified in first aid and CPR, also known as cardiopulmonary resuscitation. Contact your local American Red Cross office for information about training in your area. This concludes this presentation on health practices to create a safe and healthy environment for young children in your home. You may go back and review this recording as many times as you need to understand the content. If you have any questions, please call or email the Center for Early Learning Professionals. Thank you.